let's see our next position, Urdhva Mukha Svanasana, upward facing dog. So I want you for that to come into the prone position, lay down the belly. Like similar like a Bhujangasana, but is here we're going to lift our whole body off the floor. So let's see, first of all, make feet a little apart as you have already, hip width distance, plantar flexion. And working on the, basically on the lower of the body here, the ankle, the front of the foot is strongly pressing down and stretching the toes backward direction, heels on the top. And extension on the front of the leg and the calf completely extended, kneecaps lock here, thighs rolling inward in this position. So press as well the pinky toes, the back of the front of the pinky toes, like strongly on the floor like that. Yeah. So tailbone moving in this position, and belly moving a little forward to the chest forward, and resting the forehead or chin on the ground. So you adjust the hands beside of the chest, like as you do in Chaturanga, fingers separate, pressing the palms on the floor, and keep rolling like the buttocks down towards the heels, buttocks pushing back towards the heel, tailbone in towards the pubic plate. So anterior tailbone like a lengthening from the abdominal region, from the belly, from the anterior pelvic, anterior tailbone to the all the way to the chin. We have to make the extension, the front part of the body. So you're pressing the hands on the floor, and with the next inhalation, what you're going to do, you slowly press the hands, elbows close to the hips, and then lift your head up, lift from the top, chest, shoulders, and thighs, belly away from the floor. Hold the body, lifting the thighs up away from the ground. So pressing the ankle strongly on the floor and try to rolling the upper arms nicely. So upper arms rolling outward in this position, which will help us to open the shoulder, and try to lift from here up. Yeah, so shoulders moving upward and backward direction, and trying to elongate your cervical, the trapezius, the back of the neck, and chin upward. You can look for if somebody has a neck pain, but those are comfortable lifting the chin upward, looking upward, and nicely stretch the abdominal region. So fixing that back ribs nicely into the body and pushing the abdominal forward, chest upward, and raising the center of the sternum nicely upward, and elongate your collarbone, broaden your collarbone in this position. Stay there for a bit, press the hands and trying to lift away from the floor, and then exhale, drop the knee down or slowly relax in child position. Yeah, just relax for a bit. We'll repeat again. Just take a couple of breaths in this position. Just breathe in and breathe out. Breathe in. Ready? Let's try it on the way. So in a upward facing dog, this is a backward bending asana. So we're gonna drawing our shoulder blade nicely like into the body. So fixing the back ribs nicely into the body in order to get the expansion in the front of the chest, the lower of the chest, and as well as main role of the floating ribs. So in that position, the floating ribs moving forward and that lifted upward to have the nice extension in our abdominal region. So the clavicle, they're gonna broaden, like moving the out to the tip of the shoulders, and chest fully expand, and then back ribs same time, the scapula, lower ribs, the scapula, we're gonna fix them nicely into the body. So as we're making that action, it will help us to make the length on the lower spine. So but as long as we're rolling the tailbone in, it will help us to make the length on the lower spine. But if you relax the tailbone goes back, so it will help make us arch on the spine. So moving the tailbone in and lifting from the lower of the scapula higher, upward, and pushing the floating ribs forward and up, shoulder moving backward, chest fully expand, and then elongating the trapezius, neck longer, or you can lifting the head up or look up, or just looking front. Let's try one more time, working on the shoulder blade nicely. But yeah, this time we're going to use the brick. It can be a little bit more easier. So we're going to place the hands on the brick. So you can place the hands on the brick, or more of firm grip, like fingers down and wrist on the top of the brick. Now let's try, come on, from here, from the, drop the thighs down, yeah, slowly, yeah, come into the Urdhva Mukha Svanasana from there. Swing the self forward, perfect, like that. So thighs and knees nicely rolling inward, the crease of the buttocks, the lateral part rolling out to inward in this position. Yes. Keeping the kneecap lock in this position, pressing the front of the foot, the front of the pinky toes like strongly on the floor, and stretching the legs backward and extend from the front part of the body here. Yes, and try to push the pelvis forward towards the wrist. So the pelvic pushing forward, try to drag it forward as much you can, like that. Very good. So lifting through the front of the belly up, pelvic pushing forward, navel rising upward, floating ribs forward, and try to raise the center of the sternum high on the top. Perfect. And clavicle moving back away from each other. Try to make this space there. Press the hand and try to have a little lift in your body. Perfect, like that. You're trying to get a little bit more length on the cervical, on the spine, and shoulder tip moving backward. Nicely open the chest and straight the arms. Just stay there for a bit in a Urdhva Mukha Svanasana. Nicely expand the chest, elongate your stomach region, thighs tighten, knees tighten. As you exhale, slowly drop the knees down and push yourself back in a child position. Move your buttocks back, rest your head down. Just relax in a Balasana position.